Before starting to take Iclusig, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. Swallow the tablets whole and do not crush, break, cut, chew, or dissolve the tablets. It's important to drink plenty of fluids unless otherwise directed by your doctor. The dosage is based on your medical condition, lab results, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Using Iclusig regularly will help you get the most benefit from it. To help you remember, take it at the same time each day. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it's safe to do so, as grapefruit can increase the chance of side effects with this medicine. It's important to note that acid-lowering medications for indigestion, heartburn, or ulcers may prevent Iclusig from working. If you are taking any of these medications, make sure to consult with your doctor or pharmacist. Lastly, since this drug can be absorbed through the skin and lungs and may harm an unborn baby, women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the tablets. If you experience headache, dizziness, constipation, or loss of appetite, it's important to tell your doctor or pharmacist right away. While using Iclusig, you may experience serious side effects, but your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. Your doctor will carefully monitor you to decrease your risk. Be sure to tell your doctor immediately if you experience any serious side effects, such as weight gain, numb or tingling skin, pain or numbness in fingers or toes, fainting, irregular heartbeat, eye pain or irritation, slow wound healing, severe headache, blurred vision, or problems thinking. Sometimes, Iclusig can cause side effects due to the rapid destruction of cancer cells. To lower your risk, your doctor may prescribe additional medication and advise you to drink plenty of fluids. Contact your doctor if you experience symptoms such as signs of kidney problems or muscle spasms and weakness. Seek medical help right away if you experience very serious side effects, including sudden or severe back pain, unusual bleeding or bruising, black or bloody stools, vomit that contains blood or looks like coffee grounds, shortness of breath, or seizures. Iclusig may also raise your blood pressure, so it's important to monitor it regularly and inform your doctor if the results are high. Your doctor may prescribe medication to control your blood pressure. Additionally, this medication may lower your ability to fight infections, making you more susceptible to serious infections or worsening any existing infections. Inform your doctor if you experience signs of infection, such as a persistent sore throat, fever, chills, or a cough. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you're in the US, report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, report side effects to Health Canada at 1-866-234-2345. Before taking Iclusig, it's important to talk to your doctor about any allergies you may have. Also, make sure to let your doctor know about your medical history, especially if you have liver disease, heart problems, diabetes, or high cholesterol. Iclusig may cause dizziness or blurred vision, so it's important to avoid activities that require alertness until you know how it affects you. Limit alcohol consumption and talk to your doctor if you use marijuana. If you have any upcoming surgeries or dental procedures, be sure to inform your doctor or dentist about all the medications you are taking, including Iclusig. It may also cause wounds to heal slowly, so your healthcare provider may advise you to temporarily stop taking the medication before any procedures. This medication may also increase the risk of bleeding or bruising, so be cautious with sharp objects and avoid contact sports. Older adults may be more sensitive to the side effects, so it's important to monitor for any unusual symptoms. If you are pregnant or planning to become pregnant, talk to your doctor about reliable forms of birth control while taking Iclusig. It's important to discuss the potential risks and benefits of this medication if you become pregnant. Also, if you are breastfeeding, consult your doctor before using Iclusig, as it is not recommended to breastfeed while taking this medication and for 6 days after stopping treatment. When taking Iclusig, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. It's also important to note that other medications can impact the removal of ponitinib, the active ingredient in Iclusig, from your body, which in turn can affect how Iclusig works. Examples of these medications include azole antifungals, macrolide antibiotics, HIV protease inhibitors, rifamycins, ritonavir, drugs for seizures, and St. John's wort, among others. Be sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. And remember, always follow your doctor's instructions for taking Iclusig and any other medications. If you or someone you know has taken too much Iclusig and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. It is important not to share Iclusig with others. While taking Iclusig, it is important to undergo lab and/or medical tests such as blood pressure, eye exam, liver function, complete blood counts, lipase, and uric acid. It is important to keep all medical and lab appointments. Make sure to consult your doctor for more details. If you forget to take a dose of Iclusig, just skip that missed dose. Instead, take your next dose at the usual time the following day. Don't take a double dose to make up for the missed one. It's important to take Iclusig at the same time each day for it to be most effective. It's important to store Iclusig at room temperature away from light and moisture. Keep it in a safe place, out of reach of children and pets. When you no longer need it or it's expired, make sure to dispose of it properly. You can ask your pharmacist or local waste disposal company for guidance on how to do this. Remember not to flush it down the toilet or pour it down the drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.